Local pharmacy owner made more than $2.5 million off of medications between 2007 and 2013.
Well, the problem is these are medications that he never provided to his customers. ABC 2 News' Katrina Bush found out how he may have gotten away with it for so many years.
Well, Reddy VJ Anna Peretti has been convicted of health care fraud and identity theft. The U.S. attorney says there's a significant amount of fraud associated with health care because there's just so much money running through the system. It lasted for more than 6 years, but now Reddy VJ Anna Peretti is about to pay for the effects of his health care fraud scheme with his freedom. He's been convicted of defrauding Medicaid and Medicare of more than $2.5 million. U.S. Attorney Rod Rosenstein says with his access to patient and insurance information, Anna Peretti could fake the proper documents.
He was able to document his records as if the customer had actually come in and ordered the medication. But when investigators went in and examined his books, that is, they looked at the medications that he'd actually purchased at wholesale compared to what he claimed he'd sold at retail, it didn't match up.
And Anna Peretti didn't act alone, but with 2 pharmacy technicians originally from India. He was sponsoring their work permits in the U.S. The techs have pleaded guilty to making false statements about the scheme and are set for sentencing next month. They worked at 2 of Anna Peretti's pharmacy store chains in Bel Air. One was located at this Plumtree Road center. The other on Old Emerton Road has since been cleared out. Rosenstein says Anna Peretti repeatedly billed insurance companies for medications that customers never asked to be refilled and never received.
So, for example, if a customer came to Mr. Anna Peretti's pharmacy and ordered an expensive cancer drug, Mr. Anna Peretti would keep track of when that drug would be eligible for renewal, and then he would file an insurance claim for the renewal, even though the customer had not asked for a renewal and the drugs were not actually provided.
It's not clear if it was a tip that started the investigation in July of 2013 or if it was during a regular audit. Rosenstein says even though Anna Peretti's scheme was sophisticated in some ways, it was still vulnerable to good investigating.
We do have resources to investigate these kinds of cases, and we hope that a case like this will send a message to other people in the healthcare business and other businesses about the consequences they're going to face if they try to rip off the government and rip off insurance companies.
Now, one of those resources is a healthcare fraud working group that meets regularly, following up on leads and going over different kinds of schemes. Anna Peretti faces anywhere from 2 to 10 years in prison under federal guidelines. Katrina Bush, ABC 2 News.